Hi everyone, a very good morning to you all. I'm Dr. Gitika Arora, a practicing obstetrician and gynecologist. Today I'm going to tell you something about bleeding in early pregnancy. When we talk about early pregnancy, we mean any pregnancy which is before 12 to 13 weeks. There can be varying reason why bleeding occurs in early pregnancy. The reason can be as simple as an implantation bleeding to as serious one as having miscarriage or ectopic pregnancy. That's why it's very important that whenever you are having any sort of bleeding during early pregnancy, you should not ignore it and you should visit your doctor. Talking about implantation bleeding, it mainly occurs on a sixth day from the event of your fertilization. It occurs when your embryo is trying to embed into the lining of your womb, and it is mainly small quantity reddish bleeding. Talking about miscarriages, yes, there can be different kind of miscarriages. It can be a threatened miscarriage where the baby has a heartbeat, you have slight bleeding, and then you continue with your pregnancy. We give you add-on supports. Or it can be incomplete, inevitable, complete abortion as well, where the chances of further continuation of pregnancies are not there. So this is confirmed what kind of miscarriage are you having. This is mainly confirmed through the examination. The doctors examines you and sees the condition of the neck of your womb, does an ultrasound, and then they decide what kind of miscarriage you are having. Talking about the other cause of bleeding, it is ectopic pregnancy. I have been telling in my previous videos what we mean by ectopic pregnancy. So whenever the embryo, it implants outside the normal uterine cavity, the normal lining of the womb, it is said to be an ectopic pregnancy. And yes, it can be a serious condition because anything which is implanting outside the womb, that particular part won't support the growing fetus and it will eventually rupture or give away, and this can lead to torrential bleeding inside your tummy. So it's very important to locate your pregnancy and do an early scan. There are some symptoms apart from the bleeding which occurs with ectopic, like you may have lower tummy pain or shooting pain, shoulder tip pain, giddiness, vomiting. Some problems related to your urine or bowel can also occur. So yes, but definitely ectopic pregnancy can also be the reason of bleeding in early pregnancy. The third cause of bleeding in early pregnancy can be molar pregnancy. This is an abnormal form of pregnancy where the fetus is not formed, but instead small grape-like vesicles are formed in the womb, and this can also lead to bleeding. This occurs mainly because of some chromosomal problems. So these are some of the reasons why the bleeding can occur in early pregnancy. As we have seen, they can be simple reasons or they can be some dreadful reasons as well, some serious reasons as well. So it's always important that we don't ignore bleeding in early pregnancy. Sometimes the bleeding can be because of local issues at the neck of your womb, that is the cervix. There can be some polyps, some erosions where the inner lining of the neck of your womb comes outside. So there can be such simple reasons as well. But definitely, as I have been telling, don't ignore the bleeding. Go to your gynecologist, meet your gynecologist, have a word with her or him, and they will evaluate you and help you out. Thank you.